Northwest Human Services is a community health center. We provide comprehensive medical services that include psychiatric, mental health, obviously primary care. We also have social service programs specifically aimed at our unsheltered and unhoused community members, as well as a crisis and information hotline that's 24/7, 365 days a year, and is also our regional 988 call center. Yeah, a lot of people think that we're a state agency, but we are a nonprofit. And what's cool about that is the money that is generated go right back into our services. They go right back into serving and supporting those who access our care. Because as we know, healthcare is so much more beyond our physical needs. It's financial, it's certainly social, spiritual, all these other things. And we really try to design our programming completely on the needs of the community. So when these needs of the community come forward or we identify them, we invest in programs and projects that give back to the community in order for us to holistically treat all of the needs of our patients and clients. Our outreach team was fortunate this year to receive some funding to get a new van for our outreach efforts. Before we were using vehicles throughout the agency, which really limited us and what the team could do. Also, we needed a space where we could see folks who are living out in the encampments and on the streets in a private space. It offered a dignified way of them to have dialogue with our nursing staff and our community health worker around their health needs and the things that might be going on. Sometimes we're also looking at parts of their body that might be hurting, or being infected, or other things. And we needed a space in order to do that. Before, we were holding up blankets and jackets, or oftentimes people were in their tents and showing us these areas. And there were certainly conditions that made it difficult for us to really properly evaluate kind of what was going on with that person. And so we were fortunate to have a Salem City Council who believed in what we were doing and saw the value in bringing medical services into camps to really make sure that everybody has access to health care. With their support, City Council as well as Willamette Health Council, we purchased this new van, have it beautifully wrapped with a Salem cityscape to really give a nod to this area that we're trying to serve in the community that we reach out to every single day. So the van is set up with a sort of a small exam table. It's got cabinets where we can store medical supplies. Of course, we have Wi-Fi on the van, so we can do charting in real time. We can get orders placed and make referrals and have that direct linkage to our clinic sites. We can put people into appointments, and we can really get the ball rolling on connecting people at point of contact, meeting them where they're at, and making sure that we're doing it in the most efficient way possible. And that's also dignified and safe. It provides safety as well. So you might see the van out around town. There's a QR code on the back actually that people can scan, and they can learn more about the outreach program, what it's about, the model that we follow, as well as other ways that people can help. Oftentimes the team interacts with folks who've been disconnected from healthcare for so long, or haven't had recent contacts and are suffering from chronic conditions and other serious illnesses that have been untreated. And when we learn those things, we are quick to mobilize if they're urgent or life-threatening. And so the team may call EMTs and connect folks to the hospital, meet them there, and we've actually since launching the outreach team, it's been 4 or 5 years now. Within this model, we've actually added additional staff that can do follow-ups in the hospital, that will support discharge planning, that will follow up and make sure that they can then be connected to a provider, whether it be with us or others, that when they're discharged, that they're fully aware of their care plan, their discharge plan, their aftercare plan. Community members can go to our website if they'd like to learn more about our programs. It's a new website, nice and fresh, so I encourage folks to check it out. We accept everyone. We have many different doors you can access that through. So if you're facing significant barriers to access, we provide a number of ways in which to connect with our community members in order to deliver healthcare.